If you touch a cactus, you'll probably get the spines stuck in your skin. And if you try to pull them out, you can actually break them off in your flesh because they're so fragile. So instead, you should apply a layer of glue over the area. Once it is dried, quickly peel it off in a smooth motion. This will pull out the spines evenly, causing them to stay intact. If you lose your arm, a doctor can surgically place a titanium implant into your remaining bone. The muscles and skin are then carefully adapted around the implant, and the prosthetic is attached. Sensors inside the prosthetic are finely tuned to detect muscular contractions from your remaining upper arm. These contractions are translated into movements by the prosthetic, essentially giving you a new working bionic arm. By puncturing a hole in the side of the cow, the farmer is then able to insert a tube. Now, this is done on cows that are extremely bloated due to an accumulation of gas in their digestive system. This buildup creates pressure that can make breathing and blood circulation very difficult. The procedure allows the trapped gas to exit the cow, and some farmers even light it on fire to burn up the methane as it releases. An amoeba could enter through your nose and make its way up to your brain if you jumped into an old abandoned pool. Once inside, this amoeba travels upwards where it starts devouring brain cells. In a few days, what seems like just a headache can turn into a serious problem. This leads to a severe condition which can cause brain damage and is often fatal if not treated immediately. If a super loud noise enters your ear, the sound waves can actually rip through your eardrum. This is because these sound waves have significantly higher pressure than the air inside your ear. And as this pressure builds, it can cause the eardrum to tear, which ruptures the delicate membrane. Suddenly, you can no longer hear out of that ear as it begins to painfully ring. Now, the eardrum will eventually heal, but it'll take a few weeks before it's back to normal. A dentist cuts a flap in your gums right above your front teeth. Then a very small drill carefully files down the bone on top. Once the bone has been shaved back, the teeth are now more visible. The gums are reshaped and stitched into place on your nice new smile. If you have hammer toe, a doctor will make a small incision over the joint. Then the bones are filed down in preparation for a long metal pin that is inserted to hold them in place. This pin sticks out of your toe while it heals, providing stability. And after several weeks, the toe fully heals and the pin is pulled out. When a wound gets stapled, a doctor holds the edges of the area shut to ensure that they're aligned with each other. Then they use a tool to apply surgical staples across the area. Unlike stitches, this method allows the doctor to quickly close the wound and is often less painful. Once they're all in place, the wound begins to heal, and after a few weeks, the staples are removed. If you feel a blockage in your ear, you might have a huge chunk of earwax stuck in the canal. This waxy substance is naturally produced by your body to protect and lubricate your ears. But sometimes it can build up and harden, preventing you from hearing properly. And if you use a cotton swab to try to remove it, you'll probably end up pushing it further in. Instead, experts recommend using an over-the-counter drop that softens the wax, allowing it to exit the canal naturally. If you have a ganglion cyst, a doctor can make an incision on top of the area. These fluid-filled sacs are mostly harmless and usually form over joints. They anchor themselves to the joint using a string-like tissue called a stalk. And to remove them, a doctor will carefully cut off the stalk. Then the cyst is taken out of the joint and the incision is closed. LASIK starts with a doctor cutting a flap into the first layer of your eye called the cornea. Then, a precise laser gently shaves off tiny amounts of soft tissue from the inside of this layer. This is done to fix the shape of the cornea, since the people who get this surgery have an irregular shape. The doctor will continue to remove this tissue until the curve of the cornea is normal. This corrects the way that light enters the eye, which results in clearer vision. A doctor can place sterile maggots on an infected wound that won't heal. The maggots will begin to remove the dead and infected tissue by eating it. Now, these maggots are normally found eating dead and decomposing animals. But when they're used on certain wounds like this, these maggots can significantly aid in the healing process.